You've been so busy. You hit the ground running. Even this morning, there was posts like things, events that you were going to be at today and all
Yep.
that. And I saw something for mental health in Rochester, and that excited me a little bit.
This is something I've been thinking about for a number of years, and as adolescent mental health care,
That's big.
because there is nothing in Stratford County. Right now, if you need crisis services, inpatient crisis services for adolescents, teens, and younger, what you're looking at is you have to go to Exeter or to Concord. And there is counseling in Portsmouth that you can get, but limited. But Exeter and Concord are the only places you can go. And then, of course, the state has their facility in Hampstead that is a long-term care facility. But to get counseling services, even right now, the wait in Rochester for at mental health services in Rochester is 24 months. So if you've got a kid that's suicidal, you're looking at that and you're saying, I got a choice, either 24 months, driving to Exeter and Concord 3 days or 4 days a week, and most families can't afford that, and or just trying to deal with it at home until your child harms themselves, and that's very difficult to deal with. And I looked at what was available for services in the Rochester and Stratford County area, and I realized nothing there.
Right.
I've been talking to a number of people in the field, and everybody agrees with me that the lengths, there's a facility in Rochester. They have like 2 slots that you can get into for children. And it's, like I said, 24-month wait period. Or if something catastrophic was to happen and one of those children were no longer in the system, maybe a spot would open up sooner, but you don't want that. And these families that have to deal with it, it's a struggle for them, significant struggle. There's telehealth that they can use, but it's not the same.
No.
And when a child, and the stories, and I've heard from people who work there, kid goes in a crisis situation, maybe they try to kill themselves or whatever, they go into the emergency room and they get strapped to a gurney and they sit there for 72 hours. And there was no place for them to go. Now, they may be able to put them in a slot somewhere in a room in the emergency room or someplace in the hospital, but they're not set up to do that. Before the election, I started talking with the folks at Frisbee because I know they have a new CEO there, and HCA is running them now. I'm not a big fan of HCA, but the thing is, I said, this is something we need, and since you folks have taken a position of eliminating birth services in Rochester, your reputation isn't very good.
Right.
Would you be interested in maybe doing something good for the community? And they, I'm talking to them, and then all of a sudden I'm seeing that the CEO emails me and says, I pushed that up the ladder on HCA. And I've been talking about this. And then after I got elected, I started talking with more people about it as well. So to say, before I was a state representative and really what power do I have within the city of Rochester? I have a limited amount of power. Now I've got a bigger soapbox.
Yeah.
And I said, I'm going to make the best of this soapbox that I can. And I'm going to work on getting some action on adolescent mental health care. So I've been talking with a number of councilmen and what my ideas was. And I found one councilman who actually practices in the field of social work with children and counseling in Maine, but he's on my city council. So I told him, I said, what we need inpatient, we need clinical services, support services. I talked with the mayors of Dover and Somersworth. I said, will you guys get on board with me on this? And will you, help me work on this project? And they both said, yeah, let us know what we can do, and we'll be there with you. And actually the mayor of Dover says, we've got a person in our police department. She deals basically with juveniles. I'll send her your way. The mayor of Somersworth saying, hey, my sister-in-law lives in Rochester, but she's a guidance counselor at the Somersworth Middle School. I says, great. We're looking at focusing on the middle school and where the problems seem to be, because when I was going door-to-door campaigning, a lot of people say, the problem I have is bullying in the middle school. And I'm saying, well, I'm not a school board. I'm not running for school board, and I don't know what I can do, but I'll certainly pass the word on. And then I said, there is some things I can do. What I can try to do is bring all of the resources together that we have and maybe get them connected, because there seems to be some lack there. And I started attending the Rochester Mental Health Alliance, where I'm seeing mental health professionals.
Yeah.
Every month I sit down with them, I talk with them. And I've gotten a lot of support from them for this project. And I've got Chuck Grassie, a councilman, who's going to chair it for me, and he's got ideas. But our brains seem to be connected because every time he said something, I says, "You're this is what I'm talking about."
Yeah.
But and he has a little understanding of how he can manage a program, because I want to empower him to do the job. He's the expert in the field. I just had the thought and idea that we need to do something about this, because I see people, I listen to people, but I'm not the expert in the field to be able to have expertise on adolescent mental health care. He is. So I'm working with him, and then with these other people, such as our resource officer at the Rochester Police Department. She's been very helpful to me. The Cornerstone VNA have been very good. The folks at Frisbee, they actually now have 4 rooms for short-term beds for adolescent mental health care, something they didn't have prior to this discussion taking place, 4 months or 5 months ago. They now have that. And I'm saying, you guys are moving faster than I am here, so this is good. And also, in talking to one of their regional governmental affairs persons, he said that Portsmouth and Manchester Catholic Medical Center are going to be their 2 surgical centers. They also own Rochester and Parkland in Derry. And Frisbee and Parkland are going to become their mental health centers.
This is such great news.
This is stuff that, just pushing this up the ladder and getting their interest, they said, yeah, we got to figure out what are we going to do with Rochester and Derry, because we've got Portsmouth and Manchester, and we don't really want to spend, recreate these surgical programs in Rochester. And, we don't know what we're going to do with those 2 hospitals. Maybe we're going to close them.
Right.
And now they're saying, there is a need out there. We're hearing it now, and they're listening, and they're doing this. And I'm talking to the people at Frisbee, and I'm hoping this group gets together and they're giving me their number 2 person at the hospital is joining the task force. And the CEO said, "You've got my number 2 person. She's going to be at all of your meetings." And one of the things they're going to do, that I'd like to have them do, is to bring in some clinicians and have 5 or 7 day a week clinical help in the community. And what they're talking about is maybe we can embed people in our schools.
Wow, that would be so powerful. New Hampshire is a desert for mental health, like anything. So this is super exciting, that the fact that you would even focus on this in your first 100 days.
Yeah.
All right. I want to keep this going. So if you got more, drop it on me, please.
Because a couple of years ago, we tried to get mobile mental health centers for our high schools, for crises at our high schools. And we funded them. Money never got spent. Money just sat there, and then it got taken away. So the fact that, we looked at providing mobile mental health centers, and that's only a short-term thing. When a crisis happens at school, we rush a bunch of experts into that school, and it's gone.
Right.
So it's up to the local communities to handle that themselves. They do have money at the state level, and they've been scratching their heads and saying, well, what do we do with that money? How do we handle that money? Well, by talking with the people at Frisbee, and the CEO, who's very interested, he's young, he's new, he's great. His number 2 is right on board with all of this stuff. They're actually talking with the governor's office, and they're saying, hey, you guys got this money. What are you doing with it? And the state goes, we don't know what we're doing with it. And they said, well, what if we did this? And the state said, oh, that's great, because we don't know what we're going to do with it. But if you've got an idea, we're going to let you handle the problem. So the state doesn't want to handle the problem, and what little money they're throwing into it, they're willing to put towards these resources. So it may be that Parkland and Frisbee get state money for this program, which the state doesn't know what to do with. So, it's a big thing. We're focusing on middle school because that's where it seems to be where most of these mental health crises become come to a head.
I think that makes sense, because these are young adults, just kind of dipping their toe in the beginning of puberty in many cases. Yes. A lot of chemicals in the brain that are probably everywhere. So I think that makes sense.
The high school has already started in Rochester. Has already started a mental health club. I found out this. I was actually went to a chamber of business after hours at the technology center in Rochester, the high school tech center. And there were 3 girls there, and they get to meet the mayor. And I said, well, what are you guys working on? We're working on this project, and we're going to go to a competition this week. We're doing a report on, our presentation is going to be on teen mental health care. And I go, excuse me? This was a month ago.
Yeah.
And I says, I'm right there with you. I mean, this is a major focus of my I wanted to get this done in my first 100 days and get this rating. And May is Mental Health Awareness Month. So I wanted to make sure that, during May Mental Health Awareness Month, that we were able to announce the start of this program and get it off the board. Before the end of May, we're going to have a meeting of all our people, all of the professionals and parents and anyone else who wants to be involved, bringing them all together. And the way working with Councilor Credo, he's got an idea of a much larger group, which he's going to break down into 3 different categories so we can take on more people. I was looking at a group of maybe 12 to 15. He's looking at a group of 45. So more people in the community are going to be, 30 to 45 people. More people are going to be brought into this whole thing. But we figured if we started the middle school and then reach up into the high school, following some of these kids up into the high school, getting the, since they already have a mental health club there,
Yep.
It's going to be an easy reach. And then down at the elementary level and see what are the causes of some of these reasons that we have. I mean, a lot of it is puberty.
Yeah, and catch it before it even gets to
And
those.
catch it even before it gets
Sure.
there. There's been a lot of programs. I'm not sure exactly what the name is, but I think they called it Project Lavender, which is what the hospital uses for basically crisis de-escalation.
Okay.
And if they're willing to bring that program. It's something they have nationwide, and they want to bring that into our schools. So I'm working with, actually, I'm having lunch. I meet once a month with the chairman of the school board, and help him do a better job as chairman of the school board, but also work together on things that we can sit down and try to coordinate our efforts on things.